Hello class, welcome to Module 5. We're starting the session on strategic planning. I'm Professor Ki Chan, and I'm very excited to be leading the rest of the sessions for this semester. Keep in mind, the tools that you will learn throughout this session on strategic planning and management can be applicable anywhere you are, for your workplace, if it's in public health, private, in a nonprofit organization, and also in your personal life too. Because there's always ways to plan more effectively and efficiently, and to manage your resources to optimize your results. So let's begin. The learning objective for Module 5 Week A is, given a large public or private sector public health organization, you will analyze the needs and the demands of diverse stakeholders and constituencies as a basis for developing a strategic plan for an organization. This skill set is very important in planning a project, a program, and policy. In this segment, you will be reading chapters on strategic planning in public health and in healthcare. There are slides that are accompanying these book chapters, and there's a series of very good videos that introduce you to strategic planning, and it's a 4-part series. You'll also have an opportunity to apply what you've learned in these 2 case studies and also participate in conferencing exercise. In this particular module, the Toolkit workshop will give you an opportunity to develop a SWOT or SWOC analysis, and you will learn what the terminology is related to this, and a business plan component in response to one of the case studies. The strategic planning process is made up of many different stages to help develop and execute the strategic plan. First, you conduct a SWOT analysis, which is to identify your strengths, weaknesses, opportunities, and threats. And sometimes threats is interchangeable with challenges, so that's why it's called SWOT or SWOC analysis. Then, with this organization assessment, we can then analyze what are strategies that we can move forward, conduct some scenario explorations, identify what are the finances to move forward with this plan, and to get some feedback to implement and to roll out and to monitor and control whether this plan worked and didn't work, or what are areas for improvement. The purpose of a strategic plan is to identify where you are, your mission, your vision, and your goals, and how to get there by using this plan, and where you want to be, the overall arching purpose of your organization vision. Strategic plans and logic models are important tools to meet the organization's mission. This is a diagram of a logic model. You can see that on the far left, we identify the resources, inputs, that can drive the activities that can lead to the outputs that we're expecting to lead to initials, intermediate, and long-term outcome. The process between identifying the resources and leading to the activity is the strategy. You want to optimize your resources, your time, your finances to achieving these goals through these activities, and to do so, you need to have a strategic plan. In this case study, based on actual events, a state university attempts to unload its hospital facility yet maintains its teaching programs through a series of affiliations agreements with other influential institutions. The reactions of the stakeholders and the pros and cons and the influence of an impartial impact analysis played out in the media and political arena. The learning objectives for this module case study is that you will be able to describe the agendas and relationships of the players and stakeholders in a local health system, examine the social, political, economic, and media dimensions of a healthcare system's change, and identify strategies for injecting a public health perspective into a local health system's change. Before we begin the case study, it is important to understand the history of events that led to the new changes. As you can see, in 1987 through 1989, there was an increasing deficit from 6 million to 11 million deficit projected. The players that were involved were the University of Illinois Cook County, Michael Reese, the Hospital Medical Center, Rush University, and other medical centers around. In creating a strategic plan, you first need to identify the stakeholders and engage them. Here is listed the University of Illinois stakeholders, the leaderships, faculty, students, staff, and union. At the Cook County, it was the political leaders, staff, and union, the hospital administrators, the rush medical centers, any politician, public health agencies, any impacted community, and the media. Through this process of negotiating the best strategy, there was a series of steps that needed to be taken together in order for the proposed affiliations to do no harm, as well as the recommendation to infuse savings from the affiliations into expanding access to primary care, received widespread media and political coverage. Those steps are highlighted here. Here are the 12 steps. First, the affiliated agreement with Michael Reese should not go forward ahead of the agreement with Cook County. Second, implementation of agreements must not disrupt services to vulnerable population. Third, University of Illinois faculty and residents must provide services at both Michael Reese and Cook County's hospital in a flexible two-hospital system. Fourth, inpatient bed capacity must be increased in obstetric, pediatrics, neonatal intensive care in order to offset the loss of these services by Cook County moving its hospital service into an old university hospital setting. Fifth, Michael Reese Hospital must replace the University Hospital as a prenatal referral center and assumes responsibility for the University of Illinois Hospital prenatal network. Sixth, Michael Reese Hospital must remain in the Chicago Trauma Network as a trauma center. Seventh, Michael Reese Hospital must continue the hospital transplantation services. Eighth, University hospital employees must be guaranteed employment after the affiliations are in place. Ninth, State of Illinois public aid contracts must be revised so that the patient days are allotted consistent with the physician's re-employment as a result of these agreements. 10th, 2 new ambulatory care centers must be built on Chicago's south and west side. 11th, decentralization of county inpatient service must be accompanied by decentralization of the outpatient services. And 12th is the $25 million annually from the projected savings from these affiliated agreements should be reinvested in increasing access to the health care for Chicago and Cook County poor and medically indigenous population. As you review the case study and understand the history of events, you can start to understand which components of the Chicago health census was involved and how does these influence health at the individual and population level. What role did public health agency play in this case study? And what were the interests and agenda that they threatened or advanced? And how could the state university leadership manage this process in order to achieve its aim in a strategic, effective way? And think about how the media played out these events and what role did it have? What were the political considerations that went into the events that happened? And which of these played the most significant role? As you review this case study and the many case studies throughout the semester, think about what are some of the pitfalls that could have occurred that influenced the series of events. This is the list of the 30 pitfalls of strategic and operational planning. It's important to go through this list to see what could have happened so that you could prevent or identify when there is a speed bump and to plan accordingly. So as you review the case, review the postscript. What happened? What are lessons learned and unlearned? And how did the different stakeholders play a role in the series of events? In the second case study, which focuses on RHODODENDRON County Health Department, it was facing a challenging time in trying to balance the need for change and a focus on population-based services with financial and political reality of public health on the local level. Over the past several decades, the population was also growing, and it was having some challenges in meeting these needs. You will be reviewing the population demographic about this particular county and some history in terms of the administration, the personal health services that were being provided, the environmental health services, the impact of the stakeholders that were involved, the Board of Health, and some of the plans that were in place, such as the Public Health Improvement Plan, how the community was involved. And you'll go back in time to look at what happened in 2010 in October. What were some of the recommendations and how did the community get involved? To prepare you for the second tool next week, in addition to responding to the question prompt for this week, conversing exercise, you will conduct a SWOT analysis or SWOT analysis where you identify 5 strengths, 5 weaknesses, 5 opportunities, 5 threats or challenges. And with your group, you would then extract 5 strategic issues from the strengths, weaknesses, opportunities, threats, and challenges that you identified. Thanks, and I'll see you on Blackboard.